So we're still very much in our journey of what delegation looks like locally, but I feel like we've learned hundreds of things along the way, and I think that's really, we've been capturing all those lessons learned as we go, finding the barriers, working out solutions as a local system to overcome them. But I think it's that continual review, finding the right person and working it through and sharing that locally, local reporting. So it's continuous monitoring, really.
So we've now secured some funding from the South Yorkshire Innovation Fund, along with Sheffield University and another charity. And what we're doing is creating a methodology to actually prove a positive. And what that will do is start to look at how those outcomes work out and what those outcomes look like, and then we can learn from that. At the same time, we've applied with the university and the council for a £1 million grant from the Wellcome Trust to create a full research team to look at how do we prove positive outcomes in the community.
They did a deep dive on reviews in a particular area, and the best ones were the ones that were done by the home care worker, because they were more honest and they could ask more challenging questions.
All of my PAs I have an open line of communication with, so I just ask them to tell me if they're feeling confident on an ongoing basis to actually still do the delegated healthcare activities. There's obviously the initial training, and then for most of my PAs I'll ask them each year if they're happy to kind of continue with the tasks that I'm actually asking them to do, and if for whatever reason they're not, or I find that their confidence has dipped slightly, then the nurses are basically on call to come in within a week or two's notice to actually come in and either do training with that individual PA, or if there's 2 or 3 PAs that they're doing, then they'll do a group training session to make sure that they're happy with the tasks that I'm asking them to do.
So we continuously monitor the progress of the delegated tasks that we've put within the care home on a regular basis to ensure that what we've actually taught them is still being practiced. The care home staff also, we speak to them, we have regular surveys and feedbacks from them in terms of how it's also impacted and empowered them as healthcare professionals within the care homes.
Every 6 months they have a care plan review as a minimum, so if their needs change they have more, but as an absolute minimum it's every 6 months. And then they gather feedback from the client there, so we actively ask the client, how does your care plan still meet your needs, how's your clients, how's your carers doing, how your team are, and what does this mean for you as a family and as a person receiving this. And they give us feedback that way. We have things through staff surveys, we have client surveys we go out a couple of times a year as well.
It can be quite difficult to measure outcomes in people's lives when the changes are quite small, but if you can keep people mobile, keep the pain under control, then I think the well-being is measured in staff satisfaction and customer satisfaction, and we do that every year, and our compliments come flying in, so that's always a good way to measure it.